What to eat and what to avoid in asthma. Number 1. Tomato may help. Food made from tomato seem to help with asthma. Scientists think it may be the lycopene that help most, but more research is needed. Some studies show that it can keep you breathing better over the long term. Spaghetti, marinara, anyone. Number two, veggies. Veggies may help. There is no specific asthma diet that can get rid of your breathing trouble, but certain food may have benefits. Fruits, veggies are good place to start. They are full of chemicals called antioxidant like beta carotene and vitamin E and C. These help stop particles called free radicals that damage cells and could inflame and irritate your lungs. Number three, vitamin D. Vitamin D are helpful to treat the asthma. You get most of it from sunshine, but it is also in some food. The top choice is fatty fish like salmon, swordfish, followed by milks, eggs, orange juice, which are often fortified with vitamin D. The nutrients strengthen the response of immune system. Your body defends against germs and could lessen swelling in your airways. Having low vitamin D level can lead to more asthma attack. Number 4, nuts and seeds may help. They have got a lot of good things in them, but one in particular that might be good for asthma is vitamin E. Almond, hazelnuts, and raw seeds are good sources, as well as cruciferous vegetables like broccoli and kale. Vitamin E has tocopherol, a chemical that could help how much you cup and wheeze from your asthma. Number 5, dried fruit may be avoided. These are the some food that you may want to avoid it if you have asthma, and dried fruit are among them. Though fresh fruit, especially oranges and apple, can control your asthma, the sulfites that help preserve dried fruit could make the condition worse for some people. Alcohol, shrimp, pickled vegetable, muscarino, cherries, and bottled lemon juice also often have sulfites. Beans may be avoided because it is dangerous for the asthma. It is all about the gas they give some people. It can bloat your belly and make it harder to breathe. It may even trigger an asthma attack. Beans are almost the famous candidate. Soak them for a few hours and change the water couple of times. So listen to this effect. Other gassy culprit are garlics, onion, fried fruits, and carbonated drinks. Number 7. Coffee may be avoided. Salicylates are chemicals that occur naturally in coffee, tea, herbs, spices, and even in anti-inflammatory pills like aspirin. Though most people don't react to them, they could make it harder to breathe, especially if you are already have asthma. You may be able to improve this symptom if you cut as many as you can from diet. Number 8. Mediterranean diet may help. It's made up of a lot of fruit, vegetable, whole grain, beans, and nut. You eat fish and chicken at least twice a week and limit your red meat. Instead of butter, you could with olive oil or canola oil, and you flavor with herbs instead of salt. There are even a bit of optional red wine for adult. People who eat this way have a pure asthma attack and are less likely to get condition in the first place. Number 9, fish may help. It's all about the omega 3 fatty acid, especially in the fatty fish like salmon, herring, tuna, and sardines. They help lessen the amount of IgE in your body that makes that's an antibody that causes breathing problem in some people with asthma. But the high doses of oral steroid that some people use to treat serious asthma can block much of this helpful effect. Number 10, food allergies may hurt. You are more likely to have food allergy if you have asthma, and a food reaction could cause wheezing and other asthma symptom. In some cases, it's worse if you exercise after you eat certain foods. Try to notice what does it and avoid it. Typically trigger are nuts, dairy, wheats, and shellfish, though everyone is different. Number 11. Too much food may hurt. When you eat more calories than you burn, your body stores an extra in fat cell. You can really start to pack on the pounds. If you do that too much, you become obese. and you are more likely to get asthma, and it could make your symptom worse. In addition, you may not respond as well as typical treatment like inhaled steroid that stop an asthma attack. Number 12, supplements may hurt. As a general rule, supplements don't work as well as a nutrient from the food to protect you from asthma. So get your veggies and nuts and fish and fruits. You may have heard that soy isoflavone supplement in particular can ease asthma symptoms. Unfortunately, studies seem to show that this simply isn't the case. Talk to your doctor about any supplement you take because they can affect your medication.